One day, my grandpa, who lived with us, he needed a pacemaker, so we brought him to Emory. Got his pacemaker, he was all ready to go home, and this woman comes in his room, and she was his nurse. She said to him, "I want to teach you how to live with that pacemaker." And all of a sudden I knew that I wanted to be part of a profession that taught people how to live. My name is Sharon Pappas. I have the privilege of serving as the Chief Nurse Executive for Emory Healthcare.
Sharon Pappas is brilliant. She has this passion for the place of nursing in healthcare.
Sharon believes very deeply in what is best for the nurses is best for patients, and that drives everything she does.
She's committed to amplifying the voice of the nurse. She really wants to know what is working well, what are the barriers, and she amplifies those concerns, and she is part of the solution for nursing.
Qualities that make her unique and a strong chief nurse executive. I mean, she's really, really smart and thoughtful. I don't know how you can be a nurse and a nurse leader without having compassion be one of your core strengths.
What really stands out to me about Sharon is her uncanny ability to build relationships and her communication style. People trust her. They feel that immediately, that connection with her. That's a quality that people really exude, and not just with nurses. So she has to have the same with our physician colleagues, with administrative colleagues, and she does. She has that trust. She has that relationship that has allowed her much success here at Emory and across the country.
I've always viewed my role as a nurse leader, and particularly as a chief nurse, as not a job, it's a lifestyle. It's a role that is very comprehensive, very influential, and requires sometimes 24/7 awareness and intervention. Now, the key to that is to develop a fabulous team, but you are still accountable. And so I think that when you view it as a lifestyle, you find a way to not make that role as a nurse compete with your role as a family member, that you find a way that the two of those roles can mesh, and that your family's better because you're a chief nurse, and you're a better chief nurse because you have a lot of family support.
Sharon has really achieved a lot in her 6 years here at Emory Healthcare. Most notably, she escalated and accelerated our Magnet journey. Magnet is all about the idea of improving patient care through a more strong culture in nursing.
To be the chief nursing executive of an academic health system requires a special set of skills, because not only is this nursing leader focused on the delivery of outstanding nursing care, they also have to understand the importance of science, research, and discovery, and she gets that.
That was one of the things that drew me to Emory, was the fact that I had a board and an executive team that really was supportive and understood and promoted Magnet designation. And one of the critical elements of that is something called professional governance. And what that means is that nurses are actively involved in measuring and improving nursing practice. How do they develop competency? And how do we measure the impact of our work, the quality outcomes, the financial outcomes, and also in advancing knowledge?
Emory's Professional Nursing Practice Council is a group that meets every month. It's the chairs of the hospital level committee. Sharon opens the meeting. She gives us updates about the different goings on at the system level. And then we in turn take that to our individual hospitals. And when we have our hospital meetings, the unit practice council chairs or co-chairs are there. And we give that information to them, that shared governance.
She has a vision of how important nursing is to the delivery of health care. There's a saying today that you would not be hospitalized overnight if you did not need a nurse. And she exemplifies in everything she does every day the importance of the nursing profession.
Then we can't talk about the nursing without talking about the pandemic and the ability to drive patient care, to drive outcomes during a pandemic. Sharon was on the front lines with the nurses, making sure that we had the right care for our patients at the right time.
When the pandemic first started, I don't know if she meant this to be a tagline, but what Sharon said in a meeting, and it really stuck, was where nurses lead, the rest will follow. It's not that all of the rest of our interdisciplinary team members aren't important, of course they are, but in these really challenging crisis times that we're still in, if nursing is truly focused and is leading our mission, our vision, our values, and if we are continuing that course, then others will be able to follow us too.
Emory celebrated a lot of fabulous patient outcomes during COVID. We had very low mortality rates. And I think when you think about that, it's not just the medicine, but it was that 24/7 surveillance that nurses provided. Nursing won't be the way it was. We will rebuild it and redesign it and reimagine it into ways that are better, not only for patients, but also better for nurses. I was the nursing director of this inner city level 1 trauma center. The team that was on duty received a really bad auto accident, an individual who had had a head-on collision with a van, and in that van was a mom and her 2 children. And we had them in one of our trauma bays, and the younger sister was asleep and was okay physically. She was just resting. But their mother had perished in the accident. But this little boy was wide awake. And I'll never forget the fact that he knew every vivid detail of the accident. And so guess what he wanted to do all night long was talk. And my job was to be the listener. And I thought to myself, that is such a typical thing for nurses, that even though the physical illnesses were things that we could manage, but our job also is to care for the emotional side of illness. And I felt like that's what I had the opportunity to do with that little boy as he told me stories all night long. About a year later, there's the father and the 2 children. And he says, I just wanted you to see the kids are good, and here's my new wife. And I just really appreciated that because it helped me as a nurse be able to see the circle of healing. What I know about nurses is that when nurses are in a great culture, they will do great work. And that was so fulfilling to me, was to be able to create a work environment and a culture and relationships where nurses could actually thrive and do what they love to do.
One of the things we jokingly say when we're sitting around a table and we're trying to solve an important problem, something brilliant will come out of her mouth, a new way to approach a problem, and we all laugh and call it, that's the Pappas idea.
I think Sharon has just done a wonderful job of bringing her own views in and embracing what was already here. I can't ask for anything more.
I think when she is saying that when nursing goes well, the rest will follow, is that when we, as a profession of nursing, recognize and own the power that we have to really implement significant change, we're going to be unstoppable.
A piece of advice is to always remember God is good. Always remember you're here for a purpose, and remember why you became a nurse. And find a way to show gratitude to one of your colleagues, because when you show gratitude, that gratitude comes back. But to any nurse who might be watching this, I'd like to say 2 words, and that is thank you.